All right, we're about to see those temps drop again here in Denver, and this time of year can really pose some serious risks to our health, our heart health specifically, especially if you already have cardiovascular disease. So today we're going to get into it. Today I've got cardiologist Dr. Rainaria Pitts with Aurora Denver Cardiology Associates joining me. Thanks for being here. Happy New Year.
Happy New Year. Thank you for having me.
I am so happy to talk about this because the heart health, like it all starts here, right? We got to keep this healthy so everything else is healthy.
Yes, absolutely.
This time of the year though, I mean, there's probably a million reasons you're seeing a patient coming in for a risk. What comes to mind as far as like that's unique to this time of year that could be a problem for our heart health?
Well, I think of a couple of things. One, we're seeing colder temperature, and during that time we know, I mean, we're not seeing it right now, it's kind of nice and warm, but yes, when it gets colder, we know that your vasculature, your arteries in your body vasoconstrict in a cold environment. And so for people who have higher risk of heart disease or who have known heart disease, they can experience symptoms like angina or chest pain during this time.
Just because of the conditions outside?
Right, exactly.
Wow, okay.
And also because of the cold weather, we also see people more sedentary during this time. And so I worry with my patients who are coming in who maybe are more active during the summer times, during winter time, they're not so active. So they're less walking, they're less active, and also nutrition changes along with that, given the holidays.
I mean, we just came off of the time of year where my 3 food groups were cheese, sugar, and booze.
Yes,
like, my goodness.
Yes.
That's not good for your heart.
Not your norm. Yeah, not your norm.
Yeah, okay. And then also on top of that, there's like, you talk about the lack of exercise, and then when we are getting outside and doing things, my first thing that comes to mind is shoveling snow, heavy snow. We always warn about the danger to your heart, especially for older folks, with heavy shoveling.
Yes, absolutely. I mean, it is a perfect storm for certain patients where they can experience problems when they're shoveling snow. One, it might not be a type of activity they're used to doing, and so it's more than what they usually exert themselves to. In addition, the cold environment. So if it's extremely cold, they're already constricting their arteries or their vessels in their body. And if they have an underlying heart disease that they didn't even know about and they're overdoing it at that point, then people will experience chest pain, chest discomfort, and it is a signal that you should seek either immediate help or your primary care doctor or cardiologist.
Okay, not a lot of things we can do to control the weather. Can't control the cold, can't control the snow. So if we're contending with this, like how do we move about our day to be a little safer with our heart?
I mean, I think if there is, for example, a snowstorm and you are planning on shoveling snow, just making sure that you listen to your body. You obviously bundle up, make sure you stay warm while you're shoveling snow. Don't try to overdo it, so not the entire driveway or sidewalk at one time, and take breaks if you need to. And then also coming into wintertime, making a plan. How am I going to get my physical activity in? How am I going to get my exercise?
Yeah, and in the new year, eating healthier and just like resetting. I think we talk a lot about new year, new me, let's reset. It is a good time to like reconsider what we're putting into our bodies.
Absolutely. We always encourage a heart healthy diet for everyone, whether that's children, teenagers, young adults, older adults. That's usually in line with a Mediterranean-based diet, which is lean meats like chicken or fish and lots of fruits and vegetables.
Okay, that's just generally good advice.
Yeah.
Like we don't have to like go bust up the gym and make a million, we're not losing 50 pounds. We're just, let's be healthier in the new year.
Yes, small changes will change big habits.
Okay, all right. Am I missing anything important about as far as heart health in the year?
No, I mean, I think that you should always check in with your primary care doctor or a cardiologist just to see where you are, what your blood pressure looks like, what your sugar levels look like, what your weight looks like, and making a plan with your primary care provider to see how you can better your health in the new year.
Yeah, okay. Well, Dr. Pitts, thank you so much for joining us. This is pretty good information, I think, and let's all stay healthy and careful, right, in the new year.
Absolutely.
We might have some snow to shovel.
Yeah,
as
hopefully.
soon as this week. Hopefully. Thank you. Thanks for coming in.